My name is Dr. Omolabake Victoria Ali. Hypertension is said to complicate about 7% of pregnancies, and in Africa, it is the leading cause of maternal mortality. Hypertension in pregnancy could range from chronic hypertension, where you have hypertension already diagnosed before you become pregnant, or in the first half of pregnancy, that is before 20 weeks, where one is told that your blood pressure is 140/90 and above. Or gestational hypertension. This is diagnosed after 20 weeks gestation and there is no protein in your urine, what we call significant proteinuria, and you don't have signs of severity such as headaches, blurring of vision, or epigastric or right hypochondrial pain. We also have what we call preeclampsia. That is, after 20 weeks of pregnancy, that's 5 months, you're told your blood pressure is greater or equal to 140/90 millimeters of mercury, and also you have either signs of severity, that is headaches, blurring of vision, epigastric pain, or there's protein in your urine, or your labs, that is when you do carry out some investigations, there's target organ damage. There's also what we call eclampsia. That is when a pregnant woman who has an elevated blood pressure convulses, and this has been shown to have a poor prognosis. So therefore, in all this, prevention is key. As has always been said, prevention is better than cure, and this cannot be overemphasized. So how can we prevent hypertensive disorders in pregnancy? Now, because of the risk factors that are associated, it might be difficult to totally prevent it. However, we can reduce these risk factors. Now, if you are a chronic hypertensive, that is, you've been told you have hypertension before you become pregnant, you need to see your specialist and ensure that your blood pressure is controlled, is optimized, and your medications are reviewed by your specialist. Now, you have to start pregnancy with an optimal weight. So now we'll talk about exercise, we'll talk about your diet, you need to reduce your salt intake. And then for the drugs, there are some drugs that are not safe in pregnancy because they've been shown to increase the risk of congenital anomalies. So these drugs need to be stopped, and then an alternative is given to you before you become pregnant. So in all this, what we're talking about is the preconceptional care. So if you're on drugs like lisinopril and co, these drugs need to be converted to safe drugs in pregnancy like nifedipine or labetalol. Now, when you get pregnant, you need to ensure that you book for antenatal early. Now, the essence of this is that the risk factors for these hypertensive disorders in pregnancy can be identified by your doctors, and then measures are put in place to try to prevent them from occurring and also to prevent the complications. So you need to book your antenatal early, and when you book your antenatal early, your doctors will ask you questions about if you're hypertensive, you have a family history, or your previous pregnancies were complicated by hypertension. Now, after these risk factors have been identified, you'll be asked to carry out some investigations, and also you'll be placed on some medications to try to prevent you from developing preeclampsia and eclampsia. Now, it is important that you keep your hospital appointments, ensure that you take your medication, so compliance is very, very important. And also ensure that if you have symptoms like persistent headaches, blurring of vision, epigastric pain, or you have a sudden swelling of your legs, your face, or your arms, you need to report to your doctors immediately. Now, a lot of women, pregnant women, will have leg swelling, but when it is sudden and there's also associated facial swelling and swelling in your hands, you need to report to your hospital early. Now, it is very important to note that whatever advice your doctor gives you is what you should stick to. If they place you on medications and your medications are giving you side effects, it is not appropriate for you to just stop the medications. You need to see your doctor, complain about those side effects, so that you'll be given either an alternative or your doctor advises you appropriately. Now, like I've said, hypertensive disorders in pregnancy is a major cause of mortality, especially in Africa. However, early diagnosis and treatment can help us reduce this cause of maternal mortality. Now, in the Limi Multispecialty Hospital, we offer antenatal care where we have trained obstetricians, we have trained midwives, and we also have trained medical officers who take proper history when you present and also identify women at risk, and they are referred appropriately. We also have a multidisciplinary team that manage women with hypertensive disorders in pregnancy. We have trained obstetricians, we have pediatricians, we have cardiologists, we also have endocrinologists, and we ensure that women with these risk factors are identified early, measures put in place to prevent it, and then early treatment and management.